Hey guys, Dr. Stoker here in Los Angeles with our nurse specialist, Stacy, who is a wonderful injector. And we have her patient here who's been nice enough to answer some questions for us and share her story. She's a gorgeous mom in her early 50s. So I'm just curious, how did you hear about our practice, and how's your experience been so far?
So, as good girlfriends do, we tell each other when we find a gem such as Stacy. So one of my besties, Rosie, actually came in for a lip filler and said, you have to go see Stacy. So upon our first meeting, we realized that it's been a while since I've had filler, and it was the better route to dissolve my previous and give Stacy a clean slate to work with. And then obviously that led to conversations about what else can we do.
Right. So what I wanted to do with Nikki, nice little plan, and I always like to focus on skin too. I can go straight to Botox and filler, but what about the skin? So I always like to address that. So I did speak with her to first, we can do like a peel. Let's get some of the old skin off so that new skin comes up, get fresh skin. And then we can do a next step in doing like Morpheus 8, microneedling, PRP, exosomes now. So we're going to do a peel, get fresh skin, come back a month later, do some Morpheus, get some tightening to help fine lines, wrinkles, pores, texturing, everything. Do a couple of rounds of that, and then we want to do maybe a fourth treatment as a microneedling PRP with exosomes to get even more skin rejuvenation, get that natural beauty coming out, and then we can do filler, Botox in between if it's needed. We just kind of give it that process, see how the skin is doing. She does want her lips done for sure, so that will do, but we've already done a couple rounds of the dissolvent to get rid of the old filler that has migrated. And
how did that work? Yeah. Can you see it? Can you see the old filler melting away?
Definitely. I felt like my smile was just wrong. Like the filler wasn't in my lips anymore. It was.
To be clear, this was done elsewhere.
Yes. Yeah. To be clear. It was done elsewhere and and years ago. So it was something that is just, been wrong with my face for a while. And so I wish I had met you sooner. But to sit here in this beautiful office with this great view and also just learn about all of these new breakthrough, procedures and little things that we can do.
Sounds like a lot of procedures, but really it's just obsessing over a lot of details. Just like a good skincare regimen takes a lot of steps, or putting on makeup, doing your hair. There's lots of steps, getting dressed in the morning, all the different layers. And that's very much, I think, where somebody like Stacy comes in. She obviously has a really good eye for details like this. She has very natural results. She's about the sweetest person you could imagine. So if she pokes you, somehow it doesn't hurt as much.
She whispers like sweet things in your ear while she's poking you, so it just feels like home. I don't know.
But this is really kind of the ideal situation I see, where you have a patient who's open to trying lots of different little things, all the cutting edge procedures, where you're not yet ready to step into, or you don't need the bigger surgical procedures that I spend most of my time doing.
I'll land on your table one day.
But yeah, eventually you'll come my way. But in the meantime, Stacy's job is to take you as far as you can go before you move down the hallway to my domain. So
we won't name names, but a friend of mine is literally like on his table right now.
I should say,
and I referred them, but we will not say the name.
When my favorite way for us to get new patients is when my patient is sitting here, whoever is on their left, often they become our patient too. Okay. And so, and that's what happened here. So that's great. Okay, Stacy, well, thank you so much for explaining that. There are a lot of people who are going to appreciate that, and the only tough thing is she looks so good to start. It's just going to be a little bit, but it's going to be
everything's maintenance. We want to maintain this goodness and this beauty. So